Hello, Pain Free for Life members, and welcome back to another Monday 10-minute training. I'm Dr. Rob Van Bergen, and today I'd like to talk to you all about the link between dental pain, organ function, and microcurrent therapy. Now, one may not think too much about the connection between microcurrent and dental work, but there's considerable benefit to doing so, whether we're dealing with fighting infections back, healing tissue that's being damaged, or just working on pain management after a dental procedure. There's something that microcurrent has a role to play with here. However, to fully understand the kind of deeper connection between dental work and microcurrent, we need to look to our teeth as sources of organ dysfunction and potential warning signs of organ dysfunction as well. So whether the issue starts with the teeth and affects the organs, or it starts with the organ and it affects the teeth, right? It all has a role to play. So how does this manifest itself? So it starts with tooth meridians or dental meridians. Now, tooth meridian lines are channels or pathways throughout the human body that transport electrical energy. Parts of the human body are connected to teeth through these pathways. Therefore, it's believed that infection or pain in the teeth can be linked to health problems in other areas of the body as well. Now, I have a chart that we've designed that I'll share in a moment here that shows all of these different connections. But first, I want to get through how microcurrent works in this case. So how does microcurrent apply? Now, people can get hung up on whether the issue starts with the tooth and is therefore showing pain, infection, or degeneration, or if the issue is starting with the organs, say the liver or the kidneys, right? And manifesting therefore as pain in the tooth. But the beauty is here that it doesn't really matter. It doesn't matter which approach we take because treatment is the same. So whether you end up with having, as a person that has dental pain, or whether you've got a problem with, say, your liver, treating that tooth as a meridian using your Blue Stimulate program and, say, a tongue stimulator is actually going to serve both purposes. So it's going to be a multi-purpose option. It's going to relieve pain and it's going to re-energize the meridian. And that's important. Meridians can fall into dysfunction from a lack of energy. So we want to kind of have that balance. We're always looking for not having too much and not having too little. So by putting some energy in, we can jumpstart that area and we're going to be able to help the organ a lot. Now, you can go the other way too. You can treat the associated organ and help with the tooth, which may mean that many people watching this who are already using microcurrent on their bodies are already getting into that. You're treating your liver and it's going to help somewhat with your tooth. But the problem is that each tooth can be connected to multiple organs. So it can be a little bit more work. Often knowing that one tooth is going to work on multiple organs versus working on multiple organs to work on one tooth, the better option is usually to work on the tooth itself to get to that point. Now, an important point as well before we get into the chart is that this can apply whether you have had a particular tooth extracted or even fully replaced with artificial teeth. The socket underneath is still going to be working on that electrical flow in the same way that meridians don't suddenly stop working because of, say, an amputation. So this concept of the electrical flow still flowing through here is important because it can really impact our body's health when we're looking at having had a procedure of some kind, like a tooth extraction, and how that might have impacted the body through the creation of scar tissue. So as many people may know, scar tissue actually blocks the electrical conductivity in the fascia itself, so in the fascial tissue of the body. And these meridians, they go through the fascia. This is kind of the channels of the fascia. So this will result in the creation of dysfunction by itself. So we need to make sure that even if we have no pain, we clear out our dental scars to keep that energy flowing because we don't want something to be kind of like a slow burn, like a slow fuse that's going to eventually explode. So let's take a moment to go through the chart here. Hopefully everyone will be able to see this just fine here on the video. So this is a tooth-organ relationship chart. And we had this designed ourselves some years ago because the ones we found online were not quite accurate. And we wanted to make this as clear as possible. So you'll see here that you've got your division of your upper and lower jaws. So they're right in the middle of the document here. So your upper and lower jaws. So this is going to tell you the different teeth based on positioning and also the names, if you happen to know the names of the teeth that you're dealing with, like the lateral incisor, the canine, etc. So this is going to, if you work from the middle up, you're going to be able to see what's going on. So for example, a wisdom tooth here on the top upper jaw is connected to endocrine glands and pericardial area, as well as the small intestine and the heart. So again, going out of your way to try and treat the small intestine, the heart, and do all of that is going to be more work than treating that area. Now, if you've had that tooth extracted, or if it's causing you pain, you want to make sure you work on the area. Many people have had their wisdom teeth removed, right? It's a very common practice. But it can lead to issues with the scar tissue, causing us problems with heart, small intestines, and beyond, as well as the endocrine is anything to do with hormones, right? So we don't want to mess up our hormones that way too. But you can look through this chart here and you can see that they're essentially the same on the bottom as well, barring just a few. So there's a bit of switch around. The middle ones, let's just zoom out so you maybe can catch the full perspective here. The middle ones are very similar, right? So your incisors are going to all be connected, so like the kidneys, the prostate, the bladder, the uterus, the rectum, and the anus. They also play a role in the adrenal glands too. But then when you're looking at, say, the first bicuspid up here, so tooth number 12, you can see that nicely numbered as well, you'll see that's the lungs and large intestine on the top. But on the bottom, number 21, the first bicuspid down there, is the stomach and the spleen. Okay, now the spleen in traditional Chinese medicine is also kind of the way the pancreas goes too. So if you're looking for pancreas on there, there can be some connections between that. You'll see that what we've done here is we've kind of included the pancreas on the other side because that is kind of on some of the tooth charts, but there's not really a pancreas meridian. So the spleen tends to kind of be the good blend approach. But what you'd be looking at here is figuring out what procedures you've had, where there might be pain, where there might be damage, and what that could mean for the body. Remember, if you've had extractions, if you've even had like fillings or root canals, there's possibility of scar tissue development, even from the needles where they're injecting the freezing into your mouth, right? So clear the scars. That's the easiest step. And we're going to go through that in a moment here. I think you guys have gotten a good look at the chart here. But yeah, I mean, it's all connected to this great system. We kind of can look at the teeth as like the fuses of the meridian system, right? When one blows, that whole line can be thrown out. And it's so easy to ignore it, but it's so interconnected to everything. Okay, so back to the actual treatment itself, so that you actually know how to do the treatments. So firstly, all treatment can be applied directly through the cheek, so you don't have to go in the mouth itself if you don't want to. However, I do find it better, and I highly recommend for precision treatment that you get yourself a tongue stimulator if you don't already have one. This is an attachment that can go in the mouth. Not only that, but you can flank, because it's so bendy, you can flank the tooth, so you can put this on one prong on either side of a gum, because you can stretch it out to make sure that you're treating through the gums, which is where you're going to be hitting the roots and doing the most good, right? So highly recommend this, but if you're not into that, or you just don't have one, or you don't intend on getting one, you should be able to get the same sort of benefit from treating directly here. You'll just be treating on a larger space. Okay, so if you're going to do that, if you've had, the first thing you're going to do is you're going to work on scar tissue, right? Ask yourself the question, did you have an extraction? Have you had a root canal, right? Is there anything that might have caused trauma to the socket? Did you get punched in the face at one point in time, and there could be some trauma there? If so, treat the area of that tooth first with 77 hertz for 3 minutes. Okay, number 2, you're going to then go down in your device, from your 77 hertz, you're going to go down to blue stimulation. This is kind of a go-to meridian stimulation point. Love it. It works really well for that. So on blue stimulation, you can just treat the gum just under the tooth for 3 to 5 minutes, right? It's very, very simple. I would repeat this every 3 days, but skipping the scar tissue step, unless you had a lot of trauma early and you feel that you need to do more and more and more scar tissue work. But I wouldn't say you need to do this treatment every day to get the benefit, but you want to kind of balance things out and keep the energy going. If you're noticing any other issues within your body and you're thinking maybe they're connected to the teeth, this is the way to start, okay? Is to look at this and figure out what could be going on here. It's that easy, right? And remember that this can have a profound effect on the body because it's going to open up the meridian pathways. It's going to work on underlying issues with organs and tissue that go beyond the teeth. And if you're looking to learn more about treating dental pain specifically and just repairing physical issues with the mouth, I'd recommend you check out our YouTube channel, youtube.com/painfree4life, because I did do a video on dental issues in the past. And while it didn't cover this particular stuff, like the meridians and the deeper things, it did cover the actual treatment of dental infections, dental pain, and things like that. So you can find out more about the dental stuff there. So that's it for today's Monday 10-minute training. Thank you all for joining me, everyone. I hope you have a great rest of your week, and I will see you next week for another Monday 10-minute training. Take care.